Hi guys, welcome to Health Focus with Emmy. As last week we were talking about clinical psychologists, counseling psychology, and psychology in everything. In the current statistics of this country, we all know that there is a condition everybody jokes about. I'm stressed, I'm depressed, she died of depression, suicide, and everything. Today, the same counseling psychologist who is gonna be clinical psychologist as a specialty is here to address that challenge of how people find themselves getting down to suicide, and we are addressing depression. Welcome. If you never viewed the previous video talking about who this counseling psychologist is, kindly find it in one of the videos. Subscribe, share, and let's engage. Karibu sana again, Margaret.
Thank you, Emily.
And I know in the health sector, you have always seen depression.
Yes.
As we talk about depression, like depression, if you ask me depression, I'll tell you somebody who is not talking and who is suicidal. What is depression?
Wow. So, like you've said, depression is, I think, overused. It's a word that is overused. You'll find someone on the streets, I'm depressed. Walking, I don't call depressed. So depression, we say it's a mood disorder. It's a mood disorder that is characterized by persistent low mood or sadness and lack of interest that has been persistent. So there's a low mood and there is lack of interest. And now we have other symptoms that I can add, because you have to have at least 5 symptoms that have been there for at least persistently for 2 weeks. So there's low mood, there's lack of interest. These two have to be there.
Lack of interest to what?
Lack of interest to things that you're interested in. Lack of interest to your work, lack of interest to eating, lack of interest to participating, participating in activities that used to love engaging in. Lack of interest in daily living activities, yoga, eating.
So who will know that I don't have interest? Is it me or it's somebody I'm living with?
Even people who you can have someone who is subjective. Someone can say that I have lacked interest in things that normally I would find it easy to do. People around you will start saying, Emily no longer participates in our discussions, no longer participates in our choir meetings, no longer, for example. So lack of interest and no mood have to be there. Then now we can say someone is having lack of sleep or
sleeping excessively.
Yes, sleeping excessively. They have lack of appetite or overeating. Maybe they have they are withdrawing. Maybe they have feelings of hopelessness or helplessness, or they're feeling worthless. You'll find other people, they'll find that they have difficulties in concentration. You'll find that mtu anatafuta simu na ameshika. You'll also find people it's more, when you find out people even having suicidal thoughts, it's actually a symptom of depression.
Just to understand these suicidal thoughts, is it a culmination, or it can just be in the beginning?
Most of the time, suicide is seen as a form of, it means your depression is quite severe. Most of the time. But you can also see it just as the depressive symptoms are coming up, but most of the time you'll find it at a severe form of depression. And most of the time you'll find suicide will happen just, you have been depressed, then just when you find yourself, you have come out of depression kidogo.
Then suicide
you find someone, yes, because suicide means you have just gotten an energy to do something. Remember, depression derives your energy. You feel so fatigued, you feel you don't have energy to do anything, and even waking up to shower is work.
So for me to think of suicide, in the moment I am so depressed, I can't be able to do it.
For most people, they have the ideation, they have the plan, but the energy to do it is not there. So when they just get that small energy, they now actualize the idea.
That explains why so many people get to kill themselves when the family has seen they have come up.
Yes.
Wow.
It is actually like sometimes it's like people will say, but we were with them.
And they were so
full of
energy.
Yes. But they got now that energy to actualize their suicide plan. So
let's go back to biology. The body system. What is the pathophysiology, like the systemic things that takes place, the connectivity that takes place until you say you are now deeply depressed?
Most of the time now you are asking causes of depression. Most of the time we say there is the biological aspect, meaning that there are neurochemicals in your brain that are not stabilized.
Working well.
They are not working well. And also even when medically we can look at hypothyroidism, can bring symptoms of depression.
Hypothyroidism, what's that? Like to somebody who really doesn't understand.
Wow, how do I explain? Hypothyroidism meaning that
there is a thyroid gland.
Yes.
This thyroid gland produces a hormone.
Yes.
This hormone is there to stabilize your moods.
Yes.
Like when you're happy and when you're sad.
Yes, but
then
now
this now is low.
Yes.
Okay.
Yes. For such medical conditions, you'll find someone will having depressive symptoms, but you see it's because of those chemicals.
They're not enough in the body.
Yes. And also there's a genetic factor. Just like diabetes, hypertension, cancer, there's a genetic factor in depression. If there's a history of depression in your family, then that is a predisposing factor for you.
Wow.
Then there is environmental and social factors, which are now more rampant.
Like what happened to you when you were told nursing should not proceed?
Yes, and that is why we say, when we talk, actually when we are dealing with mental conditions, we look at the support system. Because support system works, it's very vital for a recovery of a patient. Because like for my case, if it was not for my support system, I think I would have been admitted in Mathare or something of the sort. And
done suicide.
Yes. And also the other factors, like now even when you find people with medical conditions that are chronic, they are more susceptible to depression.
Like cancer,
dialysis, diabetes, hypertension,
psychiatric issues.
Yeah, HIV.
Wow.
So if you find these are now other factors that might predispose you to depression. Actually, actually we encourage in a hospital setup, because I'm in a hospital setup, we encourage that clinicians should assess. Actually, they are trained to assess, but they should assess, which is not a common thing practiced. But
so what you're saying is that it should be one of the things during the screening of blood pressure, sugars, and everything. Psychology should be part of the things.
Yes, the mental health of a patient should be
part of the things.
It should be part of what you're screening, because even they say in every 10 patients who walk in for outpatient, 7. Actually, they say almost 7 have a psychological issue, and most of the psychological issues will be depression.
Yeah, because mental health is not really a major line of duty in our country currently.
Yes, but now the beauty is that at least the president has started. I would say the country has started focusing on mental health. Early this year, I think it was in January, February, the president formed a mental health task force that was meant to focus on the mental health state of the country.
Triggered by COVID?
Before COVID. Actually, it was before COVID.
Wow.
Yes, it was. I think it was formed in January, February, but then COVID came in. COVID again brought out a lot of mental health issues. And I think in the state, when the president addressed the State of the Nation a few weeks ago, he actually also, of course, talked again about mental health.
Wow.
So I believe as a country we are headed in the right direction.
We have addressed the predisposing factors of depression.
Yes.
And we have all seen, like, whatever the predisposing factor, the trigger is when the hormone is not enough.
Yeah.
and the neurofactors in your mind are not aligned properly.
Yes, that is one of the predisposing factors. There can be environmental factors that I've lost my job, like what has happened to most people during this pandemic. Yes, people have lost jobs, so they are meant to survive. How are they meant to survive? You find that they sink into depression.
So we've seen the symptoms, we've seen the predisposing factors. Now a patient has come to a health facility, or the patient has come to you. What are you supposed to do, and what is the role of me in the society? What am I supposed to do? I have a depressed person. Okay, in my own diagnosis, I have seen this person is withdrawn, this person is not interested in anything. What is the management?
The management, this pharmacotherapy, that is use of drugs, and psychotherapy, which is use of counseling techniques in a layman's language. So when a client is brought to us, and the medical clinician will think that this client is depressed, so what we do, we'll take just a normal history, but we'll also assess this client. These symptoms, are they mild, moderate, or severe? Mild means they know they are there, but it does not interfere with their daily activities. Moderate, they are aware their symptoms, and even other people around them have started telling them that things are not okay, and it has also maybe started interfering with some areas of their life. Severe, for most people, maybe it's even others who are telling you are not really okay, and maybe when you no longer have interest in anything. There are those people in severe depression will not want this lighting in this room. They will want a dark room. And if you are living with this particular person, you'll find that they don't leave their room, they don't open curtains, they don't put on the light, they don't shower, they don't eat. Yes, they just want to stay in that darkness. And for patients, they will tell you that is how inside they are feeling that darkness.
So let me ask you, for those people who have patients with depression, or who have had patients with depression, do these people easily engage? Like when you talk to them, can they tell you what's going on?
Their levels, that's why I first said mild, moderate, and severe. There are people you will feel they'll not engage, and they need to first be medicated so that you can be able to engage with them.
If this person is an introvert, and we know an introvert to all of us, somebody keeping to themselves, is it so easily identified? I'm so used to being quiet anyway. Yes. Can you easily diagnose that?
You can see that this quietness is more, and because maybe the quietness is not going to be the only symptom, you'll find that they are no longer keen in things that they used to be keen with. Maybe they are keen in their how they do their makeup, how they dress up, and what have you. Nowadays, they no longer care how they look. Nowadays, they no longer, maybe this is an introvert, yes, but they are keen to detail. They are no longer keen to detail. They are no longer interested in things that they used to be. So there'll be other symptoms that can be a red flag and tell you that this person at Akama is not the way they usually are.
But the truth is, it will be easy to identify it from an extrovert very fast than an introvert from the layman's perspective.
We can say that, but the other thing, sometimes you can also have people who are masking. So you have to be very keen with people. Unless you know someone so well, that's when you'll be able to pick this person.
I meant when you know somebody in a family setup, like it's your sister, it's your mother, it's your friend, that you know very well. You can easily identify an extrovert when they change than an introvert.
Yes, an introvert can take. Yes, it can hide, but we are also seeing a new aspect of this, that you find people are out in a party, clubbing and what have you, and you find you'll say this is a happy person.
Oh yeah, and they're masking.
That is a mask.
They're masking. Yes. Or they're out there laying things.
Yes.
And when they go back to themselves, depression is severe, could be.
They are participating, they'll take every task that they are given, but deep inside, they are depressed.
So we are talking about management. Now let's manage these patients.
So if it's at a moderate or severe, for some moderate, we send them to psychiatrists. For some, but there are some who can just do well with psychotherapy. For severe cases, most of them, we send them to psychiatrists. Start medication. They say the medication works between 2 weeks and 6 weeks. Then now they come for therapy. So the main techniques we use is because you see, depression interferes with how we feel, how we think, and how we behave.
How we feel, how we think, and
how we behave. Yes. So the most of the common thing that we use, or most of the common approach we use, is cognitive behavioral therapy, among other therapies that we use. But it's common.
What is cognitive?
Cognitive behavioral therapy focuses on the thoughts, behavior, and emotions. So cognitive, it will focus mainly on our thoughts, feelings, and behavior. Because like I've said, the depression will bring out thoughts, feelings, and behavior. So cognitive techniques will focus now on our thoughts, feelings, and the behavior that we are having.
Okay, so
among
if it's
others.
if it's severe, first intervention is psychiatrist.
Yes.
And who is a psychiatrist?
A psychiatrist is a medical doctor who goes ahead and studies psychiatry.
The study of the human minds and
yes,
everything.
Mental conditions.
Mental conditions.
Yes.
So after the psychiatrist, they come to you, you continue with psychotherapy of cognitive.
Yes. Most of the time we use cognitive. There are other approaches we can use called psychodynamic, because sometimes depression is caused by things that we went through as children.
Wow.
So psychodynamic approaches focuses on things that
me in 1 year.
Sorry?
Me in 1 year, 5 years, 10 years.
Yes.
It can trigger my depression in my 40 years.
Yes.
Wow.
Yes.
Okay.
So we focus on psychodynamic approaches, cognitive behavioral therapies.
What is the prognosis? Prognosis here meaning we have managed properly from a psychiatrist, medical aspect, they have dispensed drugs, they have come back to you. Do we have cases that their prognosis is still not good? Prognosis meaning the healing and coming back.
Yeah. We have just like any other medical condition, we have people who might be on treatment for the rest of their lives, and maybe they'll have multiple hospitalizations because of the nature of their depression. Wow. Even regardless of using medication and psychotherapy support system, but because of the nature of their condition, they'll continue with. So for those kind of patients, our focus mainly will be on the family, support. so that they don't get fatigued, because they can easily get fatigued. So to support them so that they can be able to support this particular patient.
Hey, I'm actually sad. I
don't
always thought that depression is something that can be managed, that you are in control.
Yeah.
Like I can be in control. That's what I always thought, that I can be on top of my game to get depressed. Then finally you find yourself so low that you can't control yourself. Then still you go to a doctor, psychiatrist, then he's not able to sort. Then I go to a counseling clinical psychologist, then I am not able to be sorted. Then
so there are some people who will, just like any medical condition, they'll be on long-term treatment, therapy, hospitalization, and there are those who just with a few medication, a few psychotherapy sessions, they're able to find their bearing.
So Margaret, if today you have a chance to be in the Ministry of Health panel talking about making policies and decisions in health, what will be your major thing in concerning mental health? Wow.
So what I would say, if I was in such a position, mental health should be like a unit that is taught even from primary school, even from baby class, primary school, secondary school, college. It should be a unit that people are taught about these mental conditions. They are taught about depression, anxiety, eating disorders amongst teenagers, and they are taught about substance use, and they are taught about some coping skills, because I believe our children are coming out not having some skills to cope with the challenges of life, to help them at least build a resilience. I think if I was given a chance to be asked what would you want to happen, I would say let us teach our children about their mental health as early as we can.
All right. And if you are addressing someone who wants to pursue a course in counseling psychologist, I'm 14 years old or even 18, so that what will you tell them? What is this all about? What will you tell a 14-year-old who wants to pursue such a career?
I will tell them, I think this is one of the units, one of the courses that helps you understand yourself before you help others understand themselves. I think that is in a nutshell, that it's one of the unique courses that helps you understand yourself before you're able to understand others. And if you have the patience and the passion to reach out and help others, I think this is a course that can help you. And to tell people, some people, I'm finding people thinking that this is a course that haitaki kusoma kwingi. No, my friend, it's hard work. It's hard work. It's hard work. It's not an easy course as people presume.
I keep on telling people that if you're doing anything healthcare, my friend, be ready to read.
Yeah.
You don't have a shortcut.
Yeah.
Be ready to read.
Yes.
What is your parting shot?
So I think my parting shot is let us take care of our mental health. As much as we take care of our physical health, there's always screening for cancer, there's always screening for diabetes, but do we screen for our mental health? So I think it's time for us to also start asking ourselves, even do a mental note, ask yourself, so how am I feeling? How are my thoughts?
Really?
Yes. So I think because there's no health without mental health, so we also need to take care of our mental health.
That's even to me. Have I ever done a screening for my mental health? I think we'll do that after this. Thank you guys for watching. Thank you for being part of this team. Thank you for following with Health Focus with Emmy. And now again, I want to say, let's support this Health Focus platform. Kindly like, comment, share, subscribe, and let's watch again for the next consultant we will be having next week. Till then, bye-bye.